some medications you can be taking, and then you start having breast milk discharge. Expression of breast milk in a woman who is not breastfeeding. The woman is not lactating, she's not breastfeeding, but the milk keeps coming out of the breast.
For the ladies that have been complaining about, oh, I have milk coming out of my breast, I have white and white tissue substances coming out of my breast. We have a guest today, and our guest, some of us know him. He's a consultant obstetrician and gynecologist, and works at the IRA Specialist Teaching Hospital, also my teacher. And it's an honor to have him every time come here to share with us his wealth of knowledge. So, ladies and gentlemen, please help me welcome Dr. Joseph Okoeguale.
Thank you, Fred. Thank you for bringing me on.
The lady tells me that I'm not pregnant, and I notice, or I'm not breastfeeding, but I notice that whenever I press my breast, I see water or milk coming out of the breast. So I decided to have you as our guest today to please talk to us about this. What is it called, and what does it really mean?
Thank you very much. You see, breast milk discharge is a very common complaint from so many young girls and women. Young girls, older women and all that. So the complaint is very, very common. The discharge in itself is not really a disease, but it's just like a symptom that is manifesting from an underlying condition. And it's important to understand that in over 50% of cases, you won't be able to tie any cause to the discharge. The person is discharging from the breast, but you can't find the specific cause of the discharge. So that is just on its own. And it's also important to mention that although it's a common complaint, a common symptom that you find in women, particularly in older women of reproductive age group, it can also be found in men, not just in women alone. You can have breast milk discharge in men, among men, and even in smaller children. You can have a very small baby discharging milk from the breast. But in majority of cases, you will find breast milk discharge among women of reproductive age group. And like I have mentioned, in many cases, in over 50% of cases, you will be able to find the cause of the discharge. For those you're able to find the cause, it could just be a physiological thing. When we say physiological, it actually means it's something probably related to or not related to a particular disease. It can be something that is cyclical or something that happens just at that particular time from, some hormonal changes, in the body of that individual, not necessarily due to a disease. For instance, excessive stimulation of the breast during sexual intercourse could cause some form of discharge. It doesn't mean that there's an underlying disease. Excessive stress, when a person is, when the lady is so stressed, so stressed, you could have milk discharge. When the breast is overtly stimulated during intercourse, sometimes you can have that. And sometimes there are some kind of dresses you will wear that will click on the nipples and all that. You have some form of discharges. And even sometimes for girls who usually who are common with checking their breast all the time, they can press it so much, have some level of stimulation, and then you have some level of discharges. And then outside that, you could actually connect it to certain problems, not necessarily problems, to certain conditions. For instance, people who are hypertensive and are on certain medication, there are some medications you can be taking and then you start having breast milk discharge. Some antihypertensive. A commonest one we know is Aldomet. We know alpha methyl dopa, just as common as it is. You know, it could be one of the precipitators of breast milk discharge. Some drug that we take to cure depression or to allay the problems of depression, some benzodiazepine, even diazepam, Valium, and some other drugs can induce some form of breast milk discharge. Many antipsychotics can induce breast milk discharge. There are some herbal concoctions that people will miss and take, and then it starts causing breast milk discharge. So just the discharge could result from certain things you're actually doing. Not necessarily that you have an underlying disease that is causing you to have it. But in some cases, you could actually have some diseases that are causing the breast milk discharge. The common one you may have is you may have some space occupying lesion, some brain tumors, some tumors in the brain. You know, some tumors in the brain that, you know, some may be very small, some may be very big, particularly occupying the pituitary area. We call them microadenoma. You know, outside that you can have some breast masses, some breast swelling that could cause some of these conditions that will lead to breast milk discharge. But don't forget the common ones. Pregnancy is be a cause, you know, a physiological cause of milk discharge. That's why when you are evaluating this woman, you must be sure that the woman is not pregnant. That's even why galactorrhea is defined as, you know, expression of breast milk in a woman who is not breastfeeding. The woman is not lactating, she's not breastfeeding, but the milk keeps coming out of the breast. That's actually what the term refers to. If the woman has a baby is breastfeeding, then you don't need to bother what is actually causing the woman, you know, to be lactating. It's when the woman doesn't have, it's not, you know, breastfeeding, it's not trying to express breast milk for any reason. But you see the milk coming out. And that's why in very young girls, very sexually active young girls, the commonest, you know, way usually, no, it may not be so much. Usually when they are having foreplay with their partners, and probably, you know, the partner, it may just be mild discharge from the breast. The partner playing with the breast and probably, you know, putting the mouth on the breast and all that. They'll come back with just and tell you that, you know, the man may start complaining. The spouse may start complaining. The boyfriend may start complaining that, you know, there seems to be something coming out from your breast. You know, that's really the first time. Because, okay, let me even check and see what level, what amount of fluid is coming out from this breast. And that's how many of them will get to know. And they will get so worried when they come to the hospital. So it's important to let them know that it's not always due to a disease. And oftentimes, even some of them will just go on their own without having to do so much about it.